Yeah. Hello, my name is Reni Martakusuma. Right now, I want to present the paper with the title Tai Chi Improves Depressive Symptom Among Community Dwelling Older Person by Mediating BDNF Ventilation, a preliminary study. I got this paper from the Geriatric Nursing Journal with impact factor 2.5. This paper published in 2022. This paper consists of five parts. That is the introduction, method, result, discussion, and conclusion. For the introduction, the author tried to explain about the older adult in the China. Older adults are more vulnerable to depression. Around 20% struggling against depressive symptoms. From this condition, the author think that urgently needed intervention to reduce depressive impact due to increasing aging population in China. Because there is a lot of exercise, the author choose the one exercise that suitable for the older person. That is a Tai Chi. Tai Chi is suitable exercise for older person because the Tai Chi have low impact, low velocity, and safety established. Because of this study, want to know the DNA methylation or epigenetic. So the author trying to make a link between intervention with the physical with the epigenetic. So they mention about the etiology of depression. Depression is both genetically and environmentally determined with epigenetic factor. It's mean that's in DNA methylation that connected this mechanism. The author focused on the BDNF. BDNF is a neurotropic. For the previous study, BDNF hypermethylation have associated with depression. From the background, the author tried to make a hypothesis. Hypothesis in this study is a demethylation of BDNF could be the epigenetic mechanism by which Tai Chi improve depressive symptoms among older person. BDNF methylation level might be associated with a severity of depressive symptoms. So, from this paper, we know that there is a gap. Gap in this study is published literature is too rare to support the above mentioned postulation. From the explanation, the author tried to make aims. Aims in this study, there is two aims. First one is determine the impact of Tai Chi of depressive symptoms and BDNF promoter methylation level among community dwelling older person with mild to moderate depressive symptoms. The second aim is to explore the association between BDNF promoter methylation and depressive symptoms. And the second part is a method. In the method, there is a study design and participant intervention, data collection, and so on. And the first one, the author, the researcher mentioned that this study is a study intervention, and the researcher make data before and after intervention, so make a pre and post test design. There is no control in this study, and the the researcher, used the three communities to take a participant, and they make a sample with the convenient sampling technique. To get the participant have an inclusion criteria. For first one, the individual that have more than 60 or equal 60 years old can include to be a participant in this study. And the individual that stay in the target community at least 1 years also can include to be a participant, and have physically and mentally suitable to practice exercise, because the intervention use Tai Chi, use Tai Chi. The next is part individual have to complete the self-assessing questionnaires and agree to take in this study. But the individual that have inclusion criteria, if that have a PHQ score more than 20, it means severe depression, have to exclude it. And also the individual that have receiving treatment and any kind of mental health also receive excluded, and use practice Tai Chi. From the title, we know that the intervention is Tai Chi. One session of 24 movement Yang Tai Chi exercise each day. The study held from the 1st until 29 May 2021. Each session of Tai Chi exercise lasted for 1 hour, including 5 minutes for 5-minute warm up, 50 minutes for Tai Chi movement, and 50 minutes for cooling down. After that, the author or researcher make a data collection. Author collected the data on the first day before intervention and the last day after intervention of the study, from the study. And then for the demographic, were collected at the beginning with a self-assessment. For pre and post tests applied for the PHQ-9 and BDNF methylation. Measurement tools in this study, for the demographic, measure age, gender, monthly income, education, marital status, and exercise frequency. The participants have to fill the questionnaire, survey questionnaire by themselves to complete for the data demographic of the participant. And then measure depressive symptoms with PHQ-9. Depressive symptom, it means it's a self-rate scale for depression-related symptoms in past 2 weeks. And the next measure for DNA methylation with pyrosequencing. Result from the pyrosequencing analyze more with a pyromark. For the DNA methylation investigation, there is 5 parts. The first one is DNA extraction using Kaigen kits. The next, bisulfite conversion using Kaigen epitech bisulfite kit. The third, with the PCR amplification, there is 2 part, like a primer design with pyromark assign design, and PCR to amplify bisulfite converted DNA sequencing, DNA sequence. And the next step, pyrosequencing. From this part, get the result. Analyze from the result, get the CpG methylation percentage. Pyrosequencing is a quantitative technique for detecting CpG methylation. The main principle from the pyrosequencing is detection of light signal from pyrophosphate during DNA strand synthesis. Result validity depends on the quality of DNA, bisulfite conversion, and PCR amplification. And then after get the data, the researcher tried to analyze two parts. There is a descriptive and bivariate analysis. For descriptive statistic analysis, they analyze for the characteristic participant, result from the demographic data from the participant. And then descriptive statistic to analyze the methylation level of BDNF promoter and PHQ-9. For bivariate analysis, the author want to know the association between BDNF methylation, and PHQ-9. Besides association, the author also want to know comparison different in the BDNF methylation between depressed and non-depressed, and also analyze for change of BDNF methylation and participants PHQ-9 after getting the Tai Chi intervention. So from this slide, we know the result from the demographic information. All of participants complete the study. There is no dropout in the study. So the total participant is 18%. From table 1, display about the basic characteristic of participant according of depressive status. From this table, we know from age, mean age is 67.89. And then the majority from the participant is female. There is 83.33%. And then have a majority for college are above for education background with 55.56%. Almost the participant married with a 72.22% and have only once a week and less for exercise frequency with 61.11. And the next result, the author mentioned about the result of the BDNF methylation and its association with depressive symptoms. First one, the average methylation level of the 9 loci, locus 1 until 9 here, of targeting sequence were significantly associated with depressive symptoms. We know from this table 2, we know this result of p-value, all of the loci of the locus 1 to locus 9 have a significant from the average methylation with the depressive symptoms. And also we can check in figure D1. This is a D1. D1 is a depression measured by PHQ-9. This is the ratio of methylation of BDNF in locus 7. Have a result significant with p-value less than 0.05. And the second result, this is the BDNF methylation level participant with depressive symptoms were significantly higher. Here, depressive symptoms were significant. We know significant from p-value, higher than without depressive symptoms. Without depressive symptoms. We can check in the table too. For example, for locus 1 in depression, there is a 20.57. This score higher than non-depression. BDNF methylation, non-depression is only 18.11 and have a significant. All of the locus is a depression higher than non-depression, but only the locus 6 that not significant. From the locus 6, we know that in the depression have a BDNF methylation level 19.20, and that is a higher than non-depression that have BDNF methylation only 16.86. But for the locus 6, there is no significant because p-value more than 0.05. Only locus 6 that result not significant. But all of the locus depression higher than the non-depression. We can check in the I1C here. 1C, there is the ratio of methylation BDNF locus 7. Yeah, locus 7, we know from the depression group, this have a higher methylation of BDNF than the non-depression. This figure is very clear for the depression higher than non-depression, and this is a significant with p-value less than 0.05. And also for locus 8 in this figure, there is a showing the depression have a higher than non-depression group, and also significant because p-value have less than 0.05. And the next result for the change of BDNF methylation and depression symptoms after Tai Chi intervention. For the BDNF methylation value decrease after Tai Chi, BDNF methylation decrease significant. We can check in the table 3. Table 3, locus 1 to 9. We can check from the column pre and post. For column 3, all of the locus is decreased. This is a pre-test, locus 1, for example, locus 1, pre-test 18.93. After get the Tai Chi intervention, the BDNF methylation for the post-test decreased to be 14.16, and it is significant associated with depressive symptoms. All of the data, all of the analysis, it is significant with depressive symptoms, because we know from the p-value that all of locus from locus 1 to locus 9 have p-value less than 0.05. And if we want to check locus 1 to locus 9 for the pre-test and post-test, there is a decrease pre-test decrease, for the post-test decrease. Post-test decrease. All of the locus have a decrease for post-test for BDNF methylation. And then we can check in figure 1E, 1B, and 1F. 1E, here, 1E. 1E figure mention about the ratio of methylation of BDNF locus 1. From the Tai Chi, after the participant get the Tai Chi for BDNF lower than pre-test, and the result is significant because p-value less than 0.05. And also we can check in the F, figure F, mention about the depression measured by PHQ-9. For after participant, after getting Tai Chi intervention, participants have a lower than the pretest, and there is a significant also with p-value less than 0.05. And we can check also result from 1B. 1B mention compare between BDNF methylation before, in this figure is before and after intervention. From this figure B in above, there is a scale until 100. But after getting the intervention, BDNF methylation have a lower. The scale less than 75 here result from the BDNF methylation. So this from the measurement approved that after getting Tai Chi intervention, BDNF methylation have a lower and significant with the depressive symptoms. And the next part is a discussion. The author explained about the BDNF methylation was significantly higher in older person with depressive symptoms. This condition in line with previous study. From the Canadian study with the case control of greater saliva BDNF methylation. Besides that, also from the South Korea with longitudinal ASEAN study, and also with the Japanese with cross-sectional using saliva, average methylation rate of BDNF parameter was significantly decreased with greater depression scores. And for the next, author discuss about the demethylation of the BDNF promoter might be a major epigenetic mechanism by which Tai Chi exert its depression alleviating effect. Besides that, this one is interesting because the exercise which integrate movement recall, task switchings, and visual-spatial processes simultaneously with physical movement. This is one of integrate from the multidisciplinary, I think. This combination of the mental and physical benefit contributes to its greater holistic effect on neurogenesis and survival than either training alone. Tai Chi is a mind-body. Tai Chi may cause a decrease in inflammation, which could then affect BDNF methylation level. And then the last one discussion mentioned about the reduce inflammatory cytokines level associated with Tai Chi may then lead to the reduced intermediation of BDNF genes. Uh, in this study, in the paper, author not mentioned clearly about the strength, but I try to make the strength. First one, I identify that epigenetic provide mind-body intervention in mental health. And then, in this study using saliva. Saliva is a non-invasive biomarker measurement that can applicable to the real-world clinical and also in the community setting. And because of the setting in the China related with the Tai Chi as a culturally relevant intervention for older person in that setting area. And then the last one, the strength is holistic or interdisciplinary approach in study integrated depression evaluation by biological mechanism. There is mentioned about the BDNF ventilation and the physical activity. It's mean Tai Chi intervention. The author mentioned about the limitation. First one is small sample size. Because of some small sample size, only 18 participants, the result maybe cannot to be a generalizability. And second, this study using saliva may not completely reflect changes in brain tissue because this study want to know or focus on the BDNF from the brain. So the author mentioned the saliva is limitation. And then from the limitation, the researcher suggests for us for future study can use the randomization and stratification. And for the Tai Chi may not work as well in moderate or severe depression. So we have for the future study, we can check with this part. And then in this study also not mentioned clearly about the power calculation of power randomization control study. So final is the conclusion. For hypermethylation of the BDNF promoter has a dose-response relationship with depressive symptoms among community-dwelling older person. Second, the methylation of BDNF gene may explain the mechanism of the depression of alleviating effect of Tai Chi. And then for BDNF level as a diagnostic and severity biomarker of depression, as well as uncovering the potential epigenetic mechanism of how Tai Chi relieves depressive symptoms. The last, the future adequate power random control trial is now indicated for further evaluate the mechanistic of the role of BDNF methylation in depression alleviating effect of Tai Chi and consider of BDNF expression. I think that's all of my presentation. Thank you for the attention.